For the biceps, a mark should be made on the body using a pen to highlight the area that the skin fold measurement should be taken. This is done on the front of the right arm at the midpoint between the acromion process, bony tip of the shoulder, and the radial, elbow joint. This point should be over the point of the bicep muscle. The skin is then pinched slightly above the pen mark made. At this point, the client's arm should be relaxed and the palm of the hand should be facing forward. The skin fold measurer pinches the skin that is being held. A measurement will be then shown on the skin fold caliper. The subject tested a score of 14. Protocol was retrieved from Top End Sports.
A pen mark is made on the participant on their subscapular. This is the bottom point of the shoulder blade. The skin is pinched slightly above the pen mark. This is with the natural fold of the skin at a 45-degree angle. The skin fold measurer pinches the skin and the reading will be shown. Our subject scored 10 mm for the subscapular.
To measure the hip, a mark is made on the body 1 inch above the hip bone. The angle of the fold should be about the same angle as the hip bone. The skin is then pinched slightly above the pen mark and a skin fold measurement is taken. The participant scored 7 on the hip measurement. The protocol used was from Lee Howard.
For the triceps, a mark should be made on the body using a pen to highlight the area that the skin fold measurement should be taken. This is done on the back of the right arm along the midline. This is the midpoint between the top of the shoulder and the end of the ulna. The skin is then pinched slightly above the pen mark made, and the skin fold measurer pinches the skin that is being held. A measurement will be shown on the skin fold measurer. The subject tested on scored 15 for the triceps. The protocol was retrieved from Rohan Education.
There are many equations that are used to convert skin fold measurements to a body fat percentage. As a result of this, we compared our participant to a generic table of ratings for percentage body fat levels. Due to the fact our client plays in the Women's Super League, we compared her results to other female athletes.
The client's bicep and tricep scores are in the acceptable category, as the scores were in the 12 to 25 mm category. The participant's biceps are 15 mm and the triceps are 40 mm. The subject's subscapular and hip are in the lean category, as the scores were less than 12 mm. The participant's subscapular are 10 mm and the hips are 7 mm.
Many athletes normally have a lower body fat percentage due to the high demands and training in their sport. The main issue with this table is that it's a generic guideline. Particular sports may have different desirable body fat levels.